Thank you for coming in today. Have you been feeling aching muscles?
Yes.
Have you had fatigue?
Yes.
Have you had headaches?
Yes.
Have you had dry eyes?
Sometimes.
And you already told me that you had a miscarriage. Because you told me you've never recovered from this 10 years ago and that you've never been feeling like yourself since, and combined with the physical symptoms you just described, I'm going to diagnose you with clinical depression. Luckily, there are medicines I will prescribe that can help you. I'm prescribing this medication Prozac, which you'll take each morning. Please do not discontinue the use of this medication without consulting me or another doctor. I've also noticed that you haven't seen your primary care doctor since the miscarriage. I urge you to do this because you need to get a physical examination. Did this all sound good?
Yes.
Hi, welcome to Susan's
Hi.
house. Thank you for coming.
No problem. Hello, Susan. Good afternoon. I can assure you that we will take good care of you today. My team and I are the very best. I will first begin by checking your breathing, blood pressure, and temperature. Easy enough?
It'll be just fine, Susan. I'm right here with you.
All right, can you sit up for me? Breathe in and out. Breathe in and out. Breathe in and out. Great. Now I'm going to check your heart rate. Good, 120, which is a little high. Now we're going to do blood pressure. (140/80). This seems a little high as well. Have you been experiencing any pain or discomfort lately?
Not really.
She's lying. She can't sleep through the night and often complains about an aching body. And she doesn't have a job anymore because she wasn't focused. I'm just worried about you, Susan.
Thank you for informing me. These side effects can quickly lead to something more serious. I first noticed the butterfly rash that is on your face. Susan, do you know why that is?
I had it for a while. I think I'm allergic to my cat. It's fine. It's fine. The allergy makes my mouth dry too.
Does your rash itch or irritate you?
I don't know.
Susan, answer the lady.
Fine. It doesn't itch, but it kind of bothers me.
How long have you had your cat?
11 years.
How long have you had the rash?
Like 5.
This appears to me as it is not an allergy. All right, Susan, your joint aching and stiffness is what concerns me the most, so I'm going to test your reflexes quickly.
Ow!
Wow, those seem a little stiff. Due to your pain and stiffness, dry mouth, rash, fatigue, and headache, and your slightly high heart rate and blood pressure, I think that all signs point to rheumatoid arthritis. I will set up a prescription at your local doctor for anti-inflammatory medications, and I highly recommend you to go to physical therapy for your joints at least once a week. Your friend can take you.
Help! Help!
What's going on?
She had a lot more to drink than normal and I'm really worried.
It's okay. Everything will be okay, Susan. First, I'm going to test your blood alcohol concentration with a breathalyzer. Breathe in. Okay, she only has a 0.04 blood alcohol concentration level.
Maybe she didn't have as much to drink as I thought.
She seems okay, but I'll do more testing to make sure. She has a very swollen abdomen. Thank you for bringing her in.
Yeah, no problem. Also, last year she was diagnosed with rheumatoid arthritis and she has depression, but she told me she stopped taking her medications.
Oh, that's not good. I see in her records that she was diagnosed with rheumatoid arthritis last year. I'm gonna go do some more physical tests just to make sure that she's okay. You can wait in the waiting room.
Okay, thank you.
Well, this is strange. You don't seem much better than last night. I'm gonna do some further testing to see if I can find a problem. First, I will perform a urinalysis where your urine is tested in different substances. I will also test your blood for anything abnormal. While testing your blood and urine, I took note of a couple things that are abnormal. First, in your urine sample, There was a slight increase in protein levels, and also there were red blood cells present. That's not good. This may require further testing because red blood cells in the urine indicate kidney problems. There was also a very low white blood cell count in your blood, which may be a serious problem. To address the RBCs in your urine, we are going to do a kidney assessment. I'm sorry, Susan, but your kidney tests do not look well. It appears that your kidney is beginning to fail. It's a good thing that your friend brought you in. There are some things we can do to help. I recommend starting dialysis. Dialysis is a machine that we can hook up to your blood that filters your blood because the kidneys are no longer able to do so. Before we do this, we need to do a chest x-ray to make sure there are no problems with your breathing. And you need to be 100% sure dialysis is the right treatment for you.
Okay, so we know that Susan was diagnosed with rheumatoid arthritis in the past. Yeah, but I'm not really seeing that today. I see something different, but I need your opinion if I'm right.
Okay, what's going on?
We began with a urinalysis and a blood test. There is protein and red blood cells found in the urine and a low white blood cell concentration in the blood. We tested the kidney and realized that in the nick of time, her kidneys are definitely failing. I think dialysis is the best option for her right now.
If they are failing, that does seem to be the case.
I just got the results from a chest x-ray. They are abnormal shadows that suggest fluid in the lungs. The patient also has stopped taking her antidepressant medication, meaning there is now a lot more estrogen in the body. Do you know what any of this could be caused by?
I agree that she doesn't have rheumatoid arthritis. In my years, I've had a handful of patients with symptoms like these. There's a disease I know of that follows these symptoms, and it could also explain why it's flaring up as she stops her medication. I think it's called lupus.
That's what I was thinking.
Consulted with my team, and we think that you need to start dialysis right away. I also have some more news. We feel you've been misdiagnosed with rheumatoid arthritis in the past. Though previous testing may have made it look like a different doctor believed it was rheumatoid arthritis, the testing we did today makes me think otherwise. My team and I have heavily discussed this, and we've concluded that you have lupus. Lupus is an inflammatory disease that occurs when the body's own immune system attacks its tissues and organs. We think that your sudden stopping of the antidepressant medications, which increased estrogen levels in the body, is what caused this flare-up. It also explains the butterfly rash on your face. This is a common sign of lupus.
What?
Here are medications that you can take to deal with your symptoms. Right now, our main concern is getting you on dialysis.